Thousands of teachers have reported having at least one medical condition, such as HIV, hypertension, or tuberculosis, which puts them at a higher risk of getting severe COVID-19. The South African Medical Research Council has conducted a survey to determine the prevalence of associated risk factors among educators. In other words, co-morbidities or underlying diseases. And as the Department of Basic Education prepares for other grades to be phased in, various provinces have reported cases of teachers and pupils who have tested positive for the virus. The Western Cape Education Department, for example, says 375 staff members at more than 230 schools have tested positive. Well, to tell us a little bit more about this educator survey, we're joined by Dr Portia Mutevedzi, who's a senior epidemiologist from the research unit. Really good to have you. Thanks very, very much for being with us.
Thanks, Leanne, for having me. Good morning.
To begin the interview, let's talk about the scope of the survey and how it was conducted.
When the Department of Education announced that they were due to open schools during this COVID period, we were approached by the unions to request for us to do a survey, just to do a bit of risk profiling and determine how many teachers or what proportion of the teachers would be at risk of contracting COVID-19 due to comorbidities, as well as at high risk of having serious COVID-19 if they did get the virus. So we then set up an online survey which was administered through the unions. So there was a link that they had to open and follow that had a set of questions. So it was basically an online survey. The survey comprised of personal identifiers, sense of names, but in the sense of a person's age, a person's gender, pregnancy status. We then also asked questions that had to do with risk factors such as smoking, obesity, sedentary lifestyle. And the final part of the questionnaire spoke to morbidities as well as being on any medication for those morbidities. So the survey was administered over a period of a week, and over that time we got over 130,000 responses, which was really excellent.
That is a big one. That's a great engagement that you've received. But now I suppose it's up to looking at the results. Now, where did you find, or were medical conditions mostly prevalent in these educators, and what percentage of those participants reported one or more condition?
Okay, so Leanne, it's worth mentioning that out of the 130 responses that we got about 90,000 of those were complete. So these were the ones where they basically responded to all the questions that we had posed to them. In terms of morbidity, we had nearly half of the population reporting morbidity, but not serious morbidity. When we looked at serious, one that constitutes either being on treatment or being under review for the disease, we had about 26% reporting hypertension, 12% reporting diabetes, 11% asthma, and HIV 8%. And these were the four highest ranking diseases that were reported across board. We did not see a lot of variability across the provinces except for HIV, which had the highest prevalence in KwaZulu-Natal. Yeah. And then in terms of obesity, we had about 18% of the respondents reporting that they were moderately or severely obese.
So, you know, we look at this and we then ask ourselves in terms of the risk factor associated with these educators. Mm-hmm. How big is it? I mean, is it a great concern for educators going into the classrooms with these comorbidities that you talk to?
So it's two-pronged, Leanne, in the sense that we are not really sure. COVID-19 is a new disease, and each day we're discovering new things through research and through clinical management of patients. So there is a study that was reported from Cape Town that actually reported a moderate increase in COVID severity risk in patients with HIV who are on ART. But this was just in the range of 2 to 2.5%. 10%. Other studies that have been done in Europe, in America, and in Asia, where the disease started, they do report that they see an increased risk of COVID-19 and an increased risk of the disease severity in people with underlying disease. But when you look at our statistics, it shouldn't be too much of a concern, because we're only looking at about 25% having hypertension. When it comes to things like asthma and HIV, the proportions are actually less than 10%. So it's a bit less alarming than before we had done this research, because we're expecting to get a high percentage and thousands of teachers having comorbidity. Yeah. That having been said, the teachers will need to practice non-medical interventions for prevention of COVID-19. So that's your social distancing, hand sanitization, and wearing of masks, to ensure that they don't contract the disease, especially those who have underlying disease who might be at increased risk of the disease. But in terms of how much more increase there is in our population who have these underlying morbidities, we would need more research as the disease evolves. We'll be able to get a bit more information and quantify the increased risk.
Yeah. I want to talk a little bit about, we've obviously been warned quite a bit about the elderly. I say the elderly because 60 years and over is not necessarily old these days. It's quite young. However, when we talk to the risk associated with being over 60, it is there, and certainly over 70 as well. But the over 50 years is a very big sector of the population that's being infected. In fact, I'm looking at last night's figures that came out. 552 deaths have been reported in people between the ages of 50 to 59. Now, that is just below 60 to 69, which is 603. So that 50-year age grouping is quite worrisome. And do you find that a lot of the teachers are in that age bracket, and what happens there?
Yes, so you are correct, Leanne. There is an increased risk of severe COVID-19 in the elderly or the older population. And in this survey, our respondents, 20% of our respondents were actually aged above 55 years. So that's a group that we need to be concerned about. That's a group that we need to closely monitor, because it's a large proportion. When we started the survey, we didn't expect to have such a significant proportion of teachers aged above 55. So that's definitely a group that we need to keep an eye on, just to make sure that they don't get the disease. And if they get the disease, it's well managed so that it doesn't end in mortality. And in as much as we want to keep the teachers safe, 20% is considerably high, that we cannot necessarily consider having all these teachers staying at home. But what we would advise is for them to take precaution when they're in schools, not only when they're in schools, because we get exposed to COVID-19 everywhere we go. So we would really recommend that they take precaution, considering that their age predisposes them to being susceptible to COVID-19 as well as to having severe COVID-19.
Yeah, indeed. And that's something.
And we also found, Leanne, that this is an age group that actually has the highest proportion with comorbidity.
Imagine, I was going to ask you that in terms of the age group breakdown. But what assurance, and this is quite an important question, and I think people would be thinking it. I mean, you take this survey, and there's been a big sort of backlash to the reopening of schools, and a lot of people are not for schools opening, including, I imagine, some teachers that are very, very nervous for themselves. So what assurance do you actually have that the participants who were answering the questions did so honestly?
That's very true, and in times like these, people tend to bias their responses towards what they want in their lives. But what we normally do in science is that we validate the results that we get. So there are two ways that you do this: pre-survey and post-survey. Pre-survey, what we do is we try and make sure that the sample of respondents is as representative as possible. So what we do is, when we send out a survey, if it's a sampled population, we make sure that the sample that receives the survey is representative of the population that we're investigating. If it's going to reach the whole population, similarly to what we did in this survey, because we didn't sample, we just sent to all teachers through their unions. What we then do is to look at the representativeness or the proportion of respondents that respond in each category. So what we did is we looked at the proportion that was responding in each province. Is it representative of the population? Normally with big surveys, you expect to have 2.5% of your population represented. In this survey, we had over 15% within each province responding, with the highest province actually having 53% of recorded educators responding. So that then gives us confidence that we at least covered a huge population that would make it representative of the underlying educators that we're interviewing.
Yeah.
The second thing that we do is we look at the age and sex distribution and compare it with the national educator statistics.
Okay.
So our survey also mirrored that. And in addition, post-analysis, we look at things like, for example, HIV status. We know that HIV prevalence is high in KwaZulu-Natal, in Western Cape. And if our data also shows the same trends and it's consistent to national statistics, we're then assured that our data is valid and it's not biased towards a specific group.
Just finally, Dr. Mutevedzi, and very quickly, the Department of Education, we know now, has gazetted directives of the reopening of schools for other grades. I mean, we're going to see approximately 1 million learners now going back to school. Do you think that this is a good idea? I mean, with the numbers increasing, the rate that they're at, and also putting your survey into your answer, do you think we're doing the right thing as South Africa?
Yes. So when we look at the disease statistics in children and we look at publications that have been done, children are less likely to transmit the disease. They are less likely to get the disease themselves. They are more likely to have asymptomatic disease, which means the risk of spreading to the next individual is very low. So within that context, and also considering that we do get COVID-19 exposure everywhere we go, whether we are in a taxi, in a mall, it is really the right direction that the Department of Education has opened schools. What we just need to ensure is that all the precautionary measures are taken to ensure that the school is a safe environment.
Yeah, indeed. Doc, thanks so much for your time. This was Dr. Portia Mutevedzi, who is a senior epidemiologist at the Respiratory and Meningeal Pathogens Research Unit at the South African Medical Research Council. Thanks again for your time talking to us about the survey they conducted to determine the prevalence of associated risk factors among educators. Let's take a break.